Now I invite Dr. Nandakumar Jairam, chairman of the another, what I say, we have three chairmen in this group, this session. So we are very privileged to have Dr. Nandakumar to speak on the subject of quality. Chairman, Columbia, Asia.
So while my slides are getting ready, let me at the outset thank my dear friends of CAHO. And I must say that it is a double-edged sword to speak at the end of two giants before me. The double-edged sword is one because a lot of good words are already spoken, so you don't know what to say. And bad because the illustrious and eloquent manner in which the last 40 minutes have shown us would leave much to be desired at the end of the day. From me, that is. Ladies and gentlemen, it's a pleasure to be here. And I stand here with two hats, one of NABH as its chairman and also of Columbia Asia Hospitals. Two hats that I wear with equal responsibility and happiness. There is really no difference between one and the other, because every organization requires to have quality, and NABH is the torchbearer of quality in healthcare in this country. In 2006, NABH was established, and between then and now, it has grown by leaps and bounds. But the initial years, as Dr. Gyani would remember and agree, were not easy. And I will pause here to say why the journey of NABH was, is, and will continue to be not an easy journey, but a journey that cannot stop and a train that has no destination. Indian healthcare is very diverse. We have rural hospitals, primary healthcare centers, government institutions, the best of tertiary care, corporate hospitals that can give you the care that you can get anywhere in the world. And a single body with single standards is expected to accredit these various organizations, because I will leave one simple word with you. Quality is quality. There cannot be a different level of quality for Hospital A and a different level of quality for Hospital B. If I may say, this is one of the biggest challenges that we have in NABH today. NABH has a large scope, and many of you may be aware of the scope that NABH has, and some of you, although I'm sure that every single person seated here is committed to quality, and that is why is a part of this day's session and perhaps of CAHO, you would still want to know that many aspects of NABH are unknown to the community. And this, my dear friends, is the second reason for NABH not being as fast in its movement in accreditation as it should be. The accreditation programs of NABH, as I said, are several. And this is in keeping with what I first stated, and that is the diversity of Indian healthcare necessitates that different hospitals are looked at differently. Let me take the example of primary healthcare centers and other small healthcare organizations in this country. These are organizations where the basic facilities are still lacking, whether it is the presence of a doctor or even, for example, basic infrastructure, it is lacking. And if you were to put all the standards of NABH and ask that hospital to be accredited, the answer is that accreditation will not happen. However, that hospital needs to have some method by which it is incentivized to take part in accreditation, and that the journey of accreditation starts in each of these hospitals. And therefore, with ingenuity, NABH introduced the entry-level standards, which basically implied a starting point, not an accreditation, but a starting point at which a hospital could say, this is where I will start my journey. I will establish this first, and then let me look at the next goalpost. At the same time, let us say the Manipals and the Narayanas of this world would not be satisfied with just that. and therefore global standards are required for accreditation of such institutions. And NABH does provide for all these. There are close to 80,000 healthcare institutions in this country, and that's an approximate number. Nobody has a clear idea as to how many hospitals, really healthcare organizations, actually exist in this country. If we look at 80,000 hospitals, and we look at the number that we have accredited today, you can see that it is far from where we should. However, that does not mean that NABH has not done what it should do. Look at that graph and look at the journey from 2006 to 2016. It is tremendous. And please understand that accreditation of a hospital is not an easy job. It requires the commitment of the auditors, their time, energy, and the cooperation of the hospital, and a continuous process to maintain quality. The last mentioned is again an important point for each one of you to note. Accreditation is not a one-time effort. Accreditation is a license that allows you to continue that practice and the journey for the entire duration of the hospital's existence. And that is another point that we have toiled hard to ensure. What we have to do is to allow such hospitals which are accredited to maintain their standards at all times, whether it is patient safety or the other standards that NABH raises. Unless this is maintained by its own efforts and not by a process of monitoring, accreditation is a wrong word to be used. I've already spoken about the pre-entry level that NABH offers, and I've told you the advantages and the purpose of this. You would also like to know that other parts of healthcare also have standards and accreditation programs that NABH offers. This includes blood bank, it includes diagnostics and imaging services, clinics, dental, and recently Ayush. The accreditation of Ayush hospitals has been a challenge because we are used to the allopathic system, and the standards set are defined by the allopathic group of physicians. But Ayush, which is an obviously important part of our country's medical fraternity today, also requires its own place in the standards of quality. I am pleased to say that what we have now achieved in terms of the standards for Ayush is really something that has been very seriously debated and brought out. I would also point out that in addition to the regular accreditation, there are SafeEye and nursing excellence that NABH attempts to look at. The two speakers ahead of me have already extolled the importance and value of nursing in the quality journey. And nursing is indeed extremely important, but not the only part of accreditation. Whereas achieving nursing excellence over and above accreditation enables you to get the standards of nursing that are appropriate for a hospital's quality standards and safety. Ladies and gentlemen, there are hospitals and more hospitals in the country, but if you look at the number that come forward to get accredited, it is still far from where it should be. The reason is that except for those who are committed to the field of quality, the rest of this country does not appreciate the value that accreditation offers today. This will change. There is no doubt about it. And this change will be led not by the government, not by the medical fraternity, but believe me, by patients themselves. If the community at large comes to know about the value and importance of quality, then they will drive hospitals and will reach only hospitals that provide quality care. Until that point is reached, it is the endeavor of NABH and bodies alike to promote quality and move this journey forward as rapidly as possible, and look at incentives that can promote this. Obviously, accreditation is not a mandated business. It is something that has to come from within the DNA of every hospital. And therefore, only incentives and carrots can be provided. There cannot be a license to say you have to get accredited. The insurance industry is one important industry that can come to our aid. As you know, more and more of healthcare in this country is being provided by and taken care of, financed by the insurance segment. And insurance has come forward and has been a good catalyst to promote accreditation. The other important point is the CGHS. The CGHS scheme has come forward to say that we require hospitals to be accredited if we have to join or join hands with such organizations. And that indeed is another boost in the arm for NABH. Therefore, we must understand that until there is a perceived value for accreditation, to push a hospital to get accredited will be difficult. Having said that, I would also like to add a few more points. There were questions raised about data and whether data should be openly put up. The answer is an absolute yes. But this data has to be authentic. I would like to ask the Indian healthcare provider to place their hand on their heart and say, my data is authentic, my data is not fudged. I will assure you that not everybody can say that with confidence. If you put fudged data onto a website, you're harming society, you're harming the industry, and the very purpose of accreditation will be lost. And we do have such issues within us. There also needs to be a uniformity of audits, and NABH has taken pains to ensure this by repeated attempts to train auditors and ensure that the comprehension of standards is uniform. After all, we are human, and human variation should not affect the accreditation or otherwise of hospitals. There has to be an efficiency of the process, not disturbing the hospital in its routine work. And this again is an important aspect that we do consider. Lastly, is cost an issue? There are hospitals that would hesitate to get accredited because of the monies involved. Let me say this, there is no cost to quality. There cannot be any situation where anybody says, I will not spend for the purpose of quality. Quality is the very essence of healthcare. We also need people like yourselves who are committed to quality and to the process of audit, who do this as not their livelihood, but as their passion. Ladies and gentlemen, my journey in quality has been from the very day I started my medical career. It will not end, not with me, not when I pass away. It is a journey that will continue forever. Thank you for asking me to speak this morning.
Very much. I think I have